Great to have you with us on Pharmacy News, and I'm absolutely delighted to say I'm joined by Dr. Lior Rauchberger.
Hi Miranda, how are you?
I'm really well, and I'm super excited to talk to you. Talk us through what exactly is myDNA Life.
Well, myDNA Life is a business that is expert in interpreting people's DNA and giving them some personalised information about how their DNA affects their health and medical and lifestyle decisions.
Now, how do you source this information, though? This is the interesting part.
Yes, it is. It's fascinating. Well, look, it's a very exciting space, and the big catchphrase is personalised medicine or personalised healthcare, and we all have unique DNA, and until now, to do a DNA test has been very expensive, and the whole genome was mapped in 2000. But now the price has come down and the technology has improved. So now there are international people around the world publishing guidelines and doing research and publishing evidence about what DNA means for people and finding things what it relates to medications and about diet and about lifestyle. And we're basically filtering all the evidence that's published, looking through all the guidelines.
Yep.
And it's quite complex, the DNA, and we're trying to make it very simple and in giving people and their doctors and their pharmacists a report to say what it all means.
So what does that mean? What does personalised healthcare mean when you have this information? What can you do with it?
Okay, well let me give you the best example where there's the most evidence, and this is the area that we're dealing is in pharmacogenomics. So it's really how does your DNA affect how you metabolise medications?
Okay.
So at the moment, if you go to see your doctor, I'll give you an example, and say he or she diagnosed you with depression. I mean, you would never be depressed, but let's just say it's quite a common illness. So at the moment, there's probably half a dozen different antidepressants that your doctor could prescribe. Why they would start you on drug B versus C versus D, and why they start you on 10 milligrams is not particularly scientific. It's just the average drug for the average person. But your unique DNA might suggest that you metabolize that drug better or differently to others. So what happens at the moment is a lot of trial and error. You go to your doctor, he prescribes you a drug, or she, and says, I'll see you in a few weeks' time. And you might go back and say, look, I've got some side effects, and then they'll obviously reduce the dose, or they might try another drug, or you might say, no, I'm still feeling unwell, and they'll increase so there's a lot of trial and error.
Of course.
3 or 4 visits
Yes.
to get to the end game.
And could be quite a lot of time.
A lot of time,
Yeah.
a lot of money,
Yeah.
and if you did have depression, it's not the nicest illness to be
Sure.
suffering from, and then you're unwell for longer than perhaps you need to. Now, genetics plays a key role, and what we understand now is that if I can measure your DNA, and you have 25,000 genes, and I'm talking about measuring only 4 or 8 of those genes at the moment,
Right.
and that can tell me how you specifically, your body metabolizes that medication. So it's not all about the genes, but the genes play a key role, and it'll just give us some more information to say, no, I don't want to start Miranda on that drug and that dose. Her particular DNA makeup suggests she should start on that dose, and we've found now that we've rolled it out in pharmacies that we're getting wonderful testimonials that people that have been struggling with their illnesses for a long time have had this test. We've got their DNA, which has lifelong relevance, and we've been able to make a big impact on their lives.
My goodness, that is so exciting.
It's very exciting.
So will it be across the board, Australia-wide?
Yeah, so we've just launched it with several large pharmacy banner groups. So we want to offer it, but there is a degree of training and accreditation. It's not for everyone. It's for the pharmacies that want to embrace professional services, which is really important, I think, in this day and age. And yes, absolutely, it's available everywhere. And what we're doing is it's constantly changing. I mean, the part of our DNA that we understand is only minuscule at the moment.
Yes.
And as we basically learn more, we'll publish more information, we'll give people more meaningful reports, and it's just growing. Yeah, so we've launched with a few pharmacy groups, and the feedback we're getting are wonderful.
I can only imagine.
Yeah.
And further on from medicines, I mean, it could tell you just about everything that you need to know in terms of healthcare.
I mean, our DNA hold the magic secrets to understand everything about our lives.
Absolutely.
So I'd probably say we probably understand about 0.5% of our whole genome. Yeah, but that will change. And governments around the world, in China, in the United States, you heard Barack Obama made a big announcement. They're investing heavily in this area. So it will. I mean, things like diet. Everyone wants to lose weight. I want to lose 6 kilos. So in time, this study's been saying, well, perhaps because of my DNA, I'd be better off going on a low-fat diet or a low-carb diet. At the moment, we try this, we try that,
Yes.
and we kind of struggle a bit along the way.
Why hasn't that worked for me?
Correct. I mean, there's some early studies around what kind of athlete you should be based on your DNA. Are you a better long-distance runner, or are you a better sprinter?
Sure.
So it's really just the tip of the iceberg. It's what I'm saying. I mean, I've got a few young kids, and I'm confident that the way that medicine we practiced and the way that my kids, when they grow up, will engage with community and pharmacies and healthcare professionals will be very different from how it's been the last 20 years.
So we're only talking a generation before all of this is implemented and it's mainstream.
Oh, absolutely. There's no question. So just to give you a sense, I could, 16 years ago, for me to map all your DNA,
Yes.
it would have cost me $100 million to do yours for one person. Today, it's $1,000 US. And I think soon it'll be a few $100s, and that when it's at that price point and it's accessible to everyone, that will be a whole Pandora's box of fascinating information.
Absolutely.
Fascinating, yes.
It will be so exciting.
Exciting, yeah.
Doctor, how is the information actually gathered?
So it's a really simple and non-invasive process. You'd walk into your pharmacy, you'd ask about the test or they'd prompt you about it, and you basically, it's just a little swab of your cheek cells, just a little swab, get a bit of the edge of your cheek, gets sent off to a laboratory, and then we get the results a few days later, and then we get the raw genetic data that's upon which we interpret. But what's really, really interesting is that those genes you have never changed for the rest of your life. So they have lifelong relevance for you. You just don't, it's not like a blood test where you've done it, you get your result, and you can discard that and you don't need that. So what we are doing is we are, with consent, obviously, of the patients and the consumers, if they want to, they can opt to have us store that digital data for them, for life, and we're sending them an ID card with a unique identifier that's theirs. And then the point is every time they're going to have another drug prescribed in 6 months or in 5 years or in 10 years, before the doctor prescribes that drug, they should say, well, hey, can we please log on to the myDNA portal, check my ID, check if my genes have relevance to the medication being prescribed, and then preemptively get on the right drug and dose. Why have side effects unnecessarily if you can avoid? Now, it won't avoid all side effects, but it'll certainly help in making a better decision at the time.
My goodness.
And that's how the system works. It's really quite simple. So I actually had my own test actually, and it found that I'm an ultra rapid metabolizer. So my body very rapidly metabolizes a breakup of codeine. So they suggested if I had any post-operative Panadeine thought, I should have lower doses because it could cause side effects, yeah? And if you have too much codeine, you can actually slow down your breathing. And so that was, I had no idea about that myself, and now I know, and they've encouraged me to have my children tested for that because there's a half a chance that they've got that as well.
Really? So even just simple medications can be...
Simple medications. So that the story for me is that me and my children, if we had an operation, rather than getting Panadeine Forte or codeine-based pain relievers, we should have like a Nurofen or an anti-inflammatory type pain relief that would be safer for us because of our genome.
My goodness.
Had no idea.
What about the security measures? Some people might be a little bit wary, thinking
Yes.
all my information is just wherever.
No, look, it's the most important. The two most important parts of the sector we're operating is scientific credibility. That's key. That the information we're imparting has evidence, and it's there's a strong evidence base behind it, and also the security of that data. I mean, it's very important data. It's we don't propose to ever own that data. It's owned by the patients, right? And we go to enormous lengths, and we invested significant sums of money to build a very secure platform with high levels of encryption where that's stored, and only you have access to that, or the people that you want to have access to that. It's very, very important, and that undermines, no one can sell the data, no one else can access it, and that's a key part of what we're offering.
What a treat to talk to you. Thank you so much for your time,
That's
Doctor.
all right.
I really appreciate it.
That's all right. Pleasure.
We'll be back with more pharmacy news in just a moment.